We see now the carpal joint. We have about the same drawing. We put ulna. Here, the radius, which is a little lower. Okay. We have the lunatum, scaphoid, triquetrum. Here we have the capitatum. We will see it's very important. Trapeze, trapezoid, and hamatum. Capitatum, hamatum, scaphoid, trapeze, trapezoid, lunatum, triquetrum. If we want to do something on the joint, we have many ligaments, about to 80 to 90 ligaments in the hand. So we must be simple because nobody can make me believe that he could be so precise. The capitatum is the center. It's a very much important one. And from this center, you have some ligament coming from the radius, and also all the ligaments are going in this direction, So we must put our thumb on the capitatum, open a little the capitatum to try to stretch this ligament in order to see where there is a fixation, because the fixation could be everywhere. And when you find the fixation, it's harder to move. You follow the listening, you do some induction, and you release. You know what is very difficult when you fall on your hand? Very often you have some fixation on this carpal part, and these fixations are very difficult to release. But if you follow the simple fact that the capitatum is the center, you will see it's easier to be precise and to release. Capitatum, and all the ligaments are joining the capitatum. We'll see now the carpal bones and carpal joint. Very often we believe that it's a very large space, but it's very narrow, as you can see. Here we have the scaphoid, lunatum, triquetrum at this part, and at the center we have the capitatum, which is the most important bone if we want to have some effect on the cartilage, on the ligament. Of course, you have the trapeze, trapezoid, capitatum, hamatum. Okay, hamatum. So put your two thumbs on the capitatum. Move the elbow. You do like anterior projection of the elbow. Okay. You come back. With your two thumbs, you separate a little the ligament and you try to do like a star. You go a star with several branches. And it's very important to focus with your two thumbs on the capitatum and after to feel where there is some abnormal tension of the ligament. It's a star, okay? All the ligaments are coming here. It's not the reality, but it's very functionally true. You can do it on this position, but you can do it also on this position, okay, in pronation. And you do the same thing. You join the capitatum, and you try to move a little bit and to check the ligament going to the bone, the carpal bones. It's more important to do on this position because the hand is more important for the anterior part than the posterior part. And you can be more precise. You can close, open. If you want to be deep, you close. The radius against the ulnar and tenard against the hypotenard. If you want to stretch, you open. It's a very important technique to do.